Hi there, our highly valued, treasured and esteemed viewers and listeners, and welcome back to your channel of choice. This video I am about to present was compiled by Dr. Nath Arua, a clinical pharmacist by training and profession who is the founder of Progressive Pharmacotherapy Consultants, the premier virtual clinical pharmacy institute for capacity building for healthcare workers. The Virtual Clinical Pharmacy Institute with a difference, where patient safety, medication therapy management and optimal clinical outcomes are very crucial and non-negotiable to us. Here we seek to remain your premier source of crucial tips for high-impact pharmacotherapy services. So, on behalf of the Institute, I humbly urge you all to sit back and spare me part of your very precious time to share with you very useful tips which may prove very, very handy in your line of duty. I now welcome you all to part 530 of our pharmacotherapy series, which majors in anxiety disorders. 2 weeks later, LTV contacts his clinician to discuss a medication concern. He reports the medication has been extremely effective in relieving his anxiety, and he is currently taking Paroctine 20 mg every morning and Alprazolam 0.25 mg thrice daily, as directed by his physician. However, his friend has told him he will become addicted to Alprazolam, and he wonders whether he should stop taking it because of this concern. My next question to you reads: what potential for abuse and dependence is associated with benzodiazepines? How should LTV be counseled regarding becoming addicted to Alprazolam? Concerns related to abuse and dependence are one major drawback to the clinical use of benzodiazepines. These agents are classified as Schedule IV controlled substances. Diazepam, Alprazolam, and Lorazepam are more likely to be abused than are oxazepam and chlordiazepocid. This difference is commonly attributed to the quicker onset of effect and high potency, which may be associated with a subjective euphoric sensation. The XR Alprazolam formulation is reported to have a lower abuse potential than immediate-release Alprazolam because of its slower onset of effect, smaller peak-to-trough ratio, and lower maximal plasma concentrations. Patients without a history of substance abuse who take benzodiazepines for therapeutic purposes are unlikely to escalate doses or use them in ways characteristic of abuse. The potential problems with benzodiazepine abuse and dependence can be avoided or minimized in several ways. First is the identification of patients who have a history of alcohol or substance abuse and using non-benzodiazepine treatments in such cases. Second, patients should be counseled about the anticipated duration of benzodiazepine use, the possibility of withdrawal symptoms, and the importance of gradual drug tapering when therapy is discontinued. The distinction between addiction and appropriate therapeutic use, which may be accompanied by some degree of physical dependence, should be explained. LTV should be advised that as long as the medication is helping his anxiety and he is taking it according to his physician's instructions, his use of Alprazolam does not constitute addiction. However, his body may develop some physiologic dependence to the drug, so if he stops taking Alprazolam abruptly, he could experience increased anxiety and other withdrawal symptoms. When Alprazolam is to be discontinued, the dose should be decreased gradually for a sufficient period to minimize withdrawal symptoms. 2 weeks later at his clinic appointment, LTV is still doing well and has shown further improvements in his generalized anxiety disorder symptoms. He has been taking the prescribed alprazolam and paroxetine for 1 month, and his paroxetine has been increased to 40 mg per day during this time. My next question to you reads: how long should medication therapy continue? Generalized anxiety disorder is a chronic disorder fluctuating in severity and often requires long-term treatment. Although long-term use of benzodiazepines can be safe and effective, it is desirable to limit treatment to the shortest duration necessary. When benzodiazepines are used for acute anxiolytic effects during initiation of antidepressant treatment for generalized anxiety disorder, they are commonly limited to short-term, that is 2 to 6 weeks, therapy. LTV has demonstrated good response after 1 month of combined alprazolam and paroxetine therapy. Because the anxiolytic effects of paroxetine usually occur between 2 and 4 weeks of therapy and he is taking a therapeutic paroxetine dose, it is appropriate to start discontinuing alprazolam at this time. While it is unlikely, LTV may experience significant withdrawal symptoms even after only 1 month of treatment. Thus, the dose should be gradually decreased for several weeks, according to tolerability of the taper. In patients who are treated with short-acting benzodiazepines for longer durations, switching to an equivalent dose of a longer-acting benzodiazepine, like diazepam, may simplify the withdrawal schedule. There is no consensus about the optimal duration of drug therapy for generalized anxiety disorder. However, recent recommendations suggest effective medication treatment be continued for at least 6 to 12 months after response. Continuation treatment with antidepressants significantly reduces the risk of generalized anxiety disorder relapse in 6 months. Therefore, paroxetine therapy should be continued for another 5 to 11 months in LTV's case. After that time, gradual paroxetine discontinuation may be considered, and reinstitution of treatment is warranted if relapse occurs. So there you have it, our highly esteemed viewers and listeners. That brings us to the end of this video. If it benefited you in any way, kindly remember to give it a thumbs up, to like it and to share it widely with your peers. Please leave your comments at the bottom. And if you haven't yet done so, I humbly urge you to subscribe to our YouTube channel. I would like to promise you all that the very, very best is yet to come. Thank you very much for viewing this video. On behalf of our senior colleague, Dr. Nath Arora, I sincerely appreciate your partnership, continued support and kind collaboration. We look forward to interacting with you in the next video, which will be part 531.